It's great to be here. My name is Darren Feldman. I'm a GU medical oncologist at Memorial Sloan Kettering Cancer Center in New York City, United States, and I specialize in treatment of kidney cancer and germ cell tumors. So the STARLITE 2 trial is an investigator-initiated study in which we are testing patients with metastatic clear cell kidney cancer who've previously progressed on immunotherapy-based treatment. And now we are testing the combination of lutetium-labeled girentuximab, which is a monoclonal antibody against CA9, which is expressed on most clear cell kidney cancers, over 90%, in combination with the checkpoint inhibitor nivolumab, to see if we can achieve responses in this population. So right now, there aren't implications for practice because the trial is still ongoing and we'll have to see results. But we do think it's a very exciting study because it represents a novel approach to treating these patients. Most of the treatments that we have right now are either VEGF receptor tyrosine kinase inhibitors or immunotherapy agents, and we don't have many other drugs and other classes to try and treat these patients, and this represents a targeted delivery of radiation approach, which we're very excited about, by binding specifically to the CA9 on the kidney cancer cells. Should not have CA9 expression on most normal cells, and so it offers a potential specific treatment for clear cell kidney cancer. And we hope that by delivering targeted radiation to the kidney cancer cells, we will promote cellular death, release of antigens that will increase antigen presentation, rev up the immune system, which combination with nivolumab will allow for therapeutic benefit. Well, if girentuximab, lutetium-labeled girentuximab, would become similar to lutetium PSMA, that would be a major advance for our patients with clear cell kidney cancer. That would be the ideal, and the reason that we're performing the study. It's an area of unmet need in kidney cancer, just like it was an area of unmet need in prostate cancer. And I believe that CA9 is as specific, if not more specific actually, than PSMA for prostate cancer. So I think that hopefully we will get to that point, but we're early on in our testing and in our study, and so we'll have to wait to see. The results of the ZIRCON study are somewhat applicable to our study, but that study was a diagnostic study, and our study is a therapeutic study. So we do incorporate that zirconium-89, zirconium-labeled girentuximab PET scan into our study. Patients who are going to get lutetium-labeled girentuximab, you want to know that you'll be actually able to target the disease, so we use the 89 zirconium-labeled girentuximab PET scan to screen patients, and only those that have disease that is avid on that zirconium-labeled girentuximab PET scan are eligible for our treatment. And then we target the same target as used for the imaging with our lutetium-labeled girentuximab. It's not directly applicable though. The ZIRCON trial was looking at small renal masses and localized disease. We're looking at patients who have metastatic disease and not small renal masses. So the data is supportive in showing that the ZIRCON data will show that, based on the press release, that a significant proportion of patients who have clear cell kidney cancer will be detected based on the zirconium-89 labeled girentuximab PET scan. And so it supports our use of it in the metastatic setting, but the data are not that applicable in terms of our study being a therapeutic study and in the metastatic setting.